Well, a very good morning to you. Thanks for joining us on Sunrise today. We're starting with a big rise in the number of children self-harming. The NSPCC blames social media for fueling the increase. The charity says that we now have a nation of deeply unhappy children. So let's have a look at some of the figures involved in all of this. And data obtained under the Freedom of Information Act by the NSPCC found that 18,788 children aged between 11 and 18 were admitted to hospital for self-harm in England and Wales last year. That's a 14% increase on what we saw the year before. Teenagers aged 13 to 17 were most likely to self-harm. That means cutting, taking an overdose, or even burning themselves. Now, figures from Childline showed it delivered 18,471 counselling sessions just about self-harm last year. That's about 50 every single day. Let's talk to our reporter, Paul Hawkins, who's here. I mean, these figures are very scary, Paul, when you look at something like that. What is causing this, and why is the NSPCC blaming social media?
Social media, also cyberbullying, also sexualisation of children in the media, but especially social media and younger platforms like Snapchat and Instagram, which tend to have younger users. It's the scrutiny of your public image. Children pretending to look like they're well, taking selfies. Look at me, I'm looking great, my hair looks great, I'm feeling great. But inside, you might be suffering, especially with anxiety, about how you look. It's about confidence in the way you look. And it's not something that you or I went through when we were growing up, so it's very much a new phenomena. Very, very deeply worrying, this rise in social media by children, which is inevitably bringing this about. Childline have had a lot of calls about this, up to 50 a day they're giving counselling to. We can just see a couple of quotes now, a couple of 14-year-olds that have called the helpline. Sometimes I get flashbacks from what happened when I was younger, and I cope with the horrible memories by cutting myself. It helps me release the pain from within. That's a 14-year-old boy who called Childline. Also a 14-year-old girl that called Childline. Recently, I've lost some people that were really close to me. When I started to self-harm, it seemed to mask the emotional pain I was feeling, even if it only helped for a little while. So, as I said, 50 children a day are getting counselling from Childline. This is what they've been telling us.
It's really encouraging that more children are going to get help through hospital if they are of that serious nature. But what we're also seeing through calls to Childline is children who are not able to get that early help. So when they're starting to self-harm, when they're feeling really low, there isn't help available for them. And we're hearing from some children that they're putting themselves at higher risk, so becoming actively suicidal just to get support. It's so vital that we really build in early support for children, so whatever they're feeling and facing, we're able to help them with it at an earlier time.
So where's the pressure for this intervention falling, this early intervention? Is it with parents? Is it with schools?
Comes at schools. And they're saying that schools need to not just focus on academia and on exams, they're also saying that they need to focus on the personal, the social well-being of young people. The government say they're investing £1.4 billion in mental health services for young people, but experts say getting in there early, nipping it in the bud early when they're at school is the key.
OK, Paul, thank you. And your thoughts on that would be very welcome this morning.